Better Buildings for Humans is powered by Advanced Glazings, makers of the Solera line of products. Solera is the leading glass glazing made specifically for architectural daylighting and with extreme insulation performance. Learn more at advancedglazings.com. Hello and welcome to this week's episode of Better Buildings for Humans. I'm your host, Joe Menchefski, and this is the podcast where we take a look at the impact that the built environment has on our health, our wellness, our productivity, and our general joy of being alive. And of course, we always talk about sustainable design and sustainable operations as well. Today, after many weeks of trying to connect, I finally get an opportunity to speak with Dr. Sandra Dedesko. Sandra is currently with EPFL in Switzerland.
That's correct.
And are you right in Zurich?
No, I'm not actually. I'm in a smaller city called Freiburg. Yeah, it's kind of near the capital, Bern.
Okay. Oh, okay. Right on. All right.
Yeah.
So Sandra and I first started talking. She was still with the Harvard Chan School of Public Health over at Harvard. And we're going to talk a little bit about some of the work she did there. But before we do that, Sandra, welcome to the show. It's a pleasure to have you.
Thanks so much for having me. It's great to be here.
Oh, it's a joy. So let's start by getting to know you a little bit better. Tell us about your background. I know you fairly recently finished your PhD, and we do want to hear about your thesis, but tell us about the pathway, how you chose architecture, building science, and how you ended up in the kind of work that you do now.
Yeah, good question. Back when I was deciding what to do for undergrad, I was pretty confident I was going to be a creative writer. And then at the last minute, there were a few small moments. I was working at a tennis club and I was having some conversations with some of the members. And all of a sudden I started thinking maybe engineering was a better path for me to go. So I enrolled in civil engineering at the University of Toronto. I was really interested in sustainability, and all their environmental work was in that program. And during my undergrad, I took a course in something called building science, or like building physics, some people call it. And I got really interested in how to design buildings so that they're more passively higher performing and sustainable. And I finished my undergrad, and I thought for sure I was going to go work at a big engineering firm, do all this design stuff, work my way up. And I had this one professor who kept encouraging me to try research. And I was like, no, I want nothing to do with that. But eventually I joined his team for the summer. It was a really cool opportunity working on like an energy efficient retrofit of a heritage home using this like novel envelope design. So very cool opportunity, very nice people. But I still wasn't so convinced. And then there was a new professor, Jeffrey Siegel, that had just come to University of Toronto from UT Austin. And he had this whole indoor air quality, healthy buildings research program. He sent me an email out of the blue actually saying, "Hi, Sandra, I hear you don't like research, but I have some research opportunities and I'm wondering if you would like to discuss." So I went and met with him, and within maybe like 10 to 15 minutes of chatting, I wanted to do research in his group. So I signed up right away and did a master's with him. It was very cool. It was, at the time, I think I thought it was very exotic engineering research. But I think looking back, I realized now that there was a lot of public health and environmental health type of work in those projects. And then after I finished my master's with his group, I was super tempted to continue into a PhD, but I wanted to work first, and I was also moving to Australia, so it was a very firm stop. So off I went, and I worked for about 5 years in different roles in sustainable design. And I was always trying to better incorporate health into the design work. And as I was trying to do that, I found myself interacting more and more with individuals and groups from public health. And eventually it just became apparent that if I really want to incorporate health into my work, maybe I should go get formal training in it. And so that's what led me to pursue a PhD in public health in Dr. Allen's group, which you mentioned, which is the Healthy Buildings team at the Harvard Chan School. So I just finished that last summer. And then fast forward, here I am in Switzerland, continuing this kind of interdisciplinary research between engineering and public health.
Oh, fantastic. Yeah, well, you had a really interesting path, and you had some really good luck in all of that too.
Yeah.
You met some great people. That's amazing. Joseph Allen is sort of a prophet in the world of healthy buildings.
Mm-hmm.
I believe he literally wrote the book called Healthy Buildings.
It's true, yeah.
Yeah. Yeah, you're basically the perfect guest. We've got health and we've got energy all combined. So that lines up beautifully with the mandate for the show. Let's go right back to Harvard.
Sure.
Let's go back to your days of Harvard and talk about the Harvard Chan. Sorry, it's T.H. Chan?
Yeah, the Harvard T.H. Chan School of Public Health. Yeah.
Perfect. Yeah. All right. And the Healthy Buildings Department, how does the Healthy Buildings group fit within the broader School of Public Health? And does it offer degree programs in healthy buildings specifically, or is it entirely research?
Yeah, good question. So there's the Harvard T.H. Chan School of Public Health, and then within that, there's the Department of Environmental Health. And then within that, there's Dr. Allen's Healthy Buildings program. So there's many departments in the school and then many programs. I was specifically in the Population Health Science Doctorate program. So that's the PhD program there within the Department of Public Health within Dr. Allen's team. It was a little bit different than I was expecting, to be honest. Like, I know we were chatting that we're both Canadian, and doing my past degrees in Canada, there, especially my master's, it was very much more focused on research. I would say like lighter on the coursework. Here or at the Chan School, it's interesting. Like the PHS program I did, every department, whether you're in social behavioral sciences or environmental health, you take 2 years of very rigorous coursework. And it's quite broad. So for someone like me that doesn't have any background in public health, it's very good. It's also overwhelming, but it's very good. You get a really comprehensive education. And then I would say for the next like 2 years, 2 to 3, depending on your degree and your research, you're pretty much immersed in your research and now specializing in the areas that you're focused on. So it is interesting. I think Dr. Allen's group is quite special. Like, you don't see a lot of very building focused groups in schools of public health. So for me, it was definitely an adjustment, like learning this new field and language, and then also trying to specialize in the area that I'm more familiar and passionate about.
Manage the connection between building occupants and the outside world using Solera translucent glass. Learn more at advancedglazings.com. Oh, right. Okay. Yeah, it's quite the adaptation and a really nice combination, especially given, the challenges that we're facing
For sure.
these days. Let's talk about indoor air. We might as well. I
Mhm.
know it's a big part of that, the focus of that group. There was an event last summer,
Yes.
indoor related to indoor air. How was it structured and what was the objective and what were some of the things that came of that event?
Yeah, so indoor air, it's kind of like the premier conference in the indoor air field, as the name suggests.
Yeah.
Last year it was in Hawaii, so I think everyone was very excited about that, but also maybe concerned about their carbon footprints. But, anyways, most of
Right.
us met in Hawaii. It's about a 4-day event, so it's quite long and very action packed. It's usually, I'd say, like more of a traditional conference format where you have like your keynotes and plenaries in the morning, and then there's different breakout sessions on different topics like ventilation, filtration, health effects, these types of things. Also, different like panel discussions and workshops and poster sessions. I feel like at this indoor air, they did a really good job kind of like fostering interaction and a lot of engagement with the posters, which you don't always see at conferences. And I think for me, I wouldn't say I'm like a strong veteran in these conferences. I've been to several over the past 10 years, but often my conference attendance would get interrupted. So I think for me, the biggest difference I saw was more interdisciplinary research, or like we saw, I think, different speakers and guests from fields that we may have not seen in the past. So I think that was very encouraging because I think you really do need different expertise to tackle these issues.
Were there any papers that really stood out to you or any posters that really caught your eye that said, wow, that's a very significant contribution to our field?
Well, I could answer that two ways. I think for me, I was still hunting for some evidence to support one of my dissertation papers. So, I mean, I was very interested in this like CO₂ exposure, biological mechanisms, how it influences cognitive function. I think more generally, there were two keynotes. Maybe I'm now biased, but the speakers were from schools of public health. And I think they brought a really nice perspective on kind of the science we do, but also how it translates to community impact and engaging with people on the ground.
We have to make sure we talk about the CO₂ work that you're
Of
doing. I know
course,
that's,
yeah.
yeah, yeah. Well, let's do it now. Yeah, you just alluded to it. That's a lovely segue. Tell me about that work and, what you're trying to determine and what you're finding.
Sure. So a lot of my dissertation research was a continuation of the COGFX studies that were already established in Dr. Allen's group. So those studies were really looking at different indoor air parameters and how that associates with different metrics of cognitive performance. I was in consulting when these papers were published. And I hadn't really seen academic work been like so exciting to practitioners before. So I thought that was very cool. And I was super curious how they did this. So I was really honored to have the opportunity to like not only learn from them, but continue the work. And so one study is actually from that initial COGFX global building study where they basically took, probably a lot of viewers are familiar with them. They're these low cost, real time indoor air quality monitors, and they'll display various parameters to tell you like what's going on in your space. So they sent those to different office buildings across the world. And then they followed numerous, like over 300 office worker participants on a smartphone based research app. So it was very cool. They could then map the exposures, like the air quality, the thermal conditions to that person's workstation. And then they would answer a number of tests and surveys. And then we can pair that data and then use different statistical methods to figure out, is there an association between this air pollutant exposure and this cognitive outcome or this perception? And so in the office building study that I was involved with and running the analysis, we saw evidence of better indoor air quality associated with higher creative thinking skills, which is interesting because I think a lot of us think, oh, creativity, that's something I'm born with. I either have it or I don't. But it's interesting that even your short term exposure to indoor air quality can actually influence your creative ability. So it's pretty cool that the air you breathe is essentially like a modifiable factor that improves your creative performance.
That's amazing. How did you actually make the correlation between creativity? Like, how did you measure creativity?
No. So that was definitely a team effort. I was super fortunate. Dr. Allen always brings in a lot of summer interns from different undergrad schools to get some research experience. And so I was, I guess, given two to mentor, and they were incredible. Together, we worked on developing a scoring method for this divergent creative thinking, this very like nebulous concept that somehow we have to put a quantification to. So basically, there's a test. Do you want me to explain those in more detail?
Yeah,
Or, yeah, okay.
let's do it. Yeah.
There's this test. It's called the alternative uses test. And basically, it'll prompt you and I with an everyday object like brick. And then you have 2 minutes to come up with as many different uses for brick as you can think of. So whether it's like doorstop, decoration, I don't know, you see some really creative ones, shall we say. And then you take all of that, the very subjective, highly variable data, and you have to score it across these like 4 conventional metrics of divergent creative thinking. So there's like fluency, the number of ideas you generate, elaboration, the level of detail, flexibility. This is a number of distinct use categories, and then originality, which is the number of unique/distinct uses generated for each prompt, like brick, across all participants. So that's a lot. Basically, like 4 different scores that you can create from this raw data, and then to actually score them, it's a combination of automated code processing, and then we had to develop a more, I would say, like human-based approach to develop these use categories and score the uniqueness and whatnot. So it was quite an involved task. I was very grateful to have such sharp and motivated interns helping.
Yeah, I
Yeah.
bet. And that's really cool. Yeah, I've always wondered that, how you made that connection. So basically, it's an intersection of two different disciplines, which is really cool. And I'm sure there's some young researchers listening today that would be paying attention to that for sure.
Yeah.
That work you did, was there a COVID context to that at all? I think it was happening at that time, right?
Yeah, so that actually, the data collection for that study occurred before I joined Harvard, and I basically signed on to join Harvard right as the pandemic hit. So I believe they had to wrap that study a little bit earlier, but that was one piece of my dissertation. The other two definitely did have a, unfortunately, COVID flavor. So as part of the COGFX series, we were then monitoring different university classrooms as like a COVID risk management measure. So we installed those real-time monitors, and now we were working with facilities teams to check the air quality levels, make sure the ventilation systems were running adequately. And we realized, you know what, we had spent all this time installing the sensors and we're spending all this time monitoring, like, why don't we turn it into a study? So now we wanted to look at cognitive function or COGFX in the classroom. It seemed like very convenient. You already have all these students attending classes in these spaces. We have this smartphone research technology, and now we have the monitors. So why don't we see what's going on in these spaces? And this one, there's two studies. One, actually, I was just working on the proofs for the paper today, so it should be out any minute now. The other one is a little further behind in the peer review process, but I'll talk about the one that's about to come out that's been accepted. This is very interesting because there's a lot of debate. Is it CO2? Is it other indoor air pollutants? What levels do we need to see when we see this effect on cognitive performance? And so, interestingly for us, when we started collecting the data, like the indoor air quality data from the monitors, I mean, from an operational perspective, it was great. The CO₂ was so low. But from a research perspective, we were like, oh no, like, are we going to see an association? Is there going to be any effect? These concentrations are so low. And very interestingly, we did still see an association between lower CO₂ and higher cognitive performance. This time we used different metrics. I had a bit of enough of the creative thinking scoring, and I wanted to
Yeah.
explore some more objective standardized metrics using two different tests. So this time we were looking at metrics of accuracy and speed or response time. And it was so interesting that even at these low concentrations of CO₂, a lot lower than you would see in a lot of, I will say, like typical buildings operating to past standard, building design guidelines. These are much lower concentrations we're looking at, but we still see this no threshold effect between increasingly lower concentrations of CO₂ and higher cognitive performance scores. And I know that was a lot, but for
Yeah.
any of the researchers listening, or also, I guess, just for general understanding, I think it's more of a hot topic on the scientific side of things, where a lot of people want to make it really clear that we don't think it's necessarily CO₂ itself that's driving these associations, but rather this mixture of indoor air pollutants that vary with CO₂. So we're only measuring CO₂, but from some other analyses we did as well, it really looks like there's a lot of other things happening with the CO₂ as a result of ventilation and occupancy that are influencing these cognitive performance outcomes that we look at.
So CO2 is the indicator.
CO₂ is an indicator, yeah, but we
And
haven't
then
used these like causal methods. You might hear people say like, oh, correlation doesn't mean causation. Like we're looking
Mhm.
at association. So we're just looking at when this is low, is this high? And we're not saying because that's low, this is high. We're just, oh, look at this.
So what are some of the other pollutants that are, related to the presence of CO2 that have significant impacts? What are the big ones?
I mean, we cannot say from our study as we didn't measure them or include them in our
Okay.
models, but we can infer and we assume that a lot of them are like volatile organic compounds or basically gases associated with you and I. So like we're very big emitters of
Mhm.
VOC from like natural processes like metabolism, but also depending on, your personal hygiene products, any fragranced items, these types of things, you're going to bring a lot of VOCs into the environment. And so from past work that has had these more specialized, high grade, very costly measurement instruments, they've seen very distinct marks of students and their personal care products in the classrooms. And we see with our very low cost sensors, we see this kind of correlation between these TVOCs and CO₂. So we would assume it is some of those gases that past work has seen to have an impact.
So there's some percentage of society, I don't know, I think the number was around 15 to 20% that are sensitive, I believe is the term,
Yeah.
that would be impacted by those VOCs. Did you see, a particular subgroup that were highly impacted, or were the results general across the population that you studied?
In our study, we were just looking at general population results and we try to account for some of that individual variation in our model. But no, we can't. Yeah, unfortunately, we can't report on those individual differences here.
Not just curious, just
Yeah.
curious. I used to be involved in the world of scent-free cleaning products,
Oh,
actually.
interesting.
Yeah, and so that's why I was able to pull the 15 to 20%. But I was just curious if there was, some specifics
Yeah,
that we're
no.
watching.
If my mom
Okay.
was in that study, definitely I would watch her because she is scent sensitive. She definitely falls in that population. But yeah.
Yeah. Yeah, me too. It drives me
Okay.
crazy. And
Yeah.
and I don't have major impacts, but Do you want to bring lots of healthy, beautiful natural light in your building and still meet energy codes? Try Solera from Advanced Glazings. Learn more at advancedglazings.com. Okay, let's change to the work from home study that you were involved with. I assume there was a pretty high degree of variability in the healthiness of the participants' normal workplaces and their homes. Is that the case, or am I missing the sort of the primary objectives?
I would say so. The workplaces, like their actual offices, like pre-COVID, we
Yeah.
don't have an assessment of that. I will say a lot of them are from the same companies, and the companies, I will infer, have very nice offices. So I actually think workplace satisfaction with the physical environment, I would presume to be high. Their homes, we did do like a background survey on those homes. They also seem to be quite well maintained, well operational homes. And then when we did look at the data, again, those measured indoor parameters, yeah, the results would back that up that these are pretty well ventilated, well maintained homes. So
So
I guess, yeah.
was there a difference? Was there a big difference between home and their places of work in terms of productivity, feeling of healthiness, or were they part of the objectives?
Well, for the main part of the first analysis of this study, they were looking at the work from home conditions on their performance. And so we saw
Okay.
kind of like a similar storyline where, in this case, the CO₂ concentrations were actually even lower than the classroom study that I mentioned. And so they see like they say slight association. So it wouldn't reach statistical significance at the traditional zero point zero 0.05 alpha level. But in general speak, like, yes, they did see like some evidence that lower CO₂, even at those even lower levels, is still associated with better work performance. And then with the temperatures, they found that very high and very low temperatures across the measured range started to impair those metrics of performance. I will say there's been some other interesting work in this area, and it's probably quite intuitive when I say that people found their work from home performance versus office was highly individual. So things like their personal satisfaction with their at home workspace was a really key indicator. And even like outside of the physical environment, one study also from the Harvard School found that individual characteristics, such as if you're male over 35 in a senior position and living with a spouse or partner, you had a much better time working from home than others. So I think there's many factors at play that everyone's still trying to parse out after the pandemic.
Right.
Yeah,
I got to dive a little deeper on the CO₂, though. I know the studies didn't necessarily look at economics, but let's talk a little bit about economics because
sure.
it's going to matter. When we talk about the improvement in cognitive ability associated with lower levels of CO₂, that's also got to drive productivity. It
Yeah.
has to. So, like, do you have any sort of idea that, if CO₂ level goes from X to 0.5X, it's a 2% improvement in productivity? Do you have any sort of numbers like that say building owners, companies that own buildings with people come into could make a good decision about whether there's like consequential payback to improve air quality?
Yeah, sure. That's a really tough question. I know we actually have a colleague about to join us here that's like ready to tackle that topic. He has an economics background, so he's really excited to bring his spin to this question. I think, yes, I think it's really necessary. For me, I can't really assign a dollar per value. I will say, like, from some of the studies I've mentioned from my dissertation, for example, when we take those statistical models and we try to translate them into an effect, what we found is that for a 100 part per million decrease in CO₂, you can see anywhere up to an 11% increase in one of these. This is from the creativity paper, for example, in one of these creative test outcomes. So if I put my scientist hat on, I'm saying like, oh, this is like, this is one test. I cannot extrapolate this to like a real working environment. But if you think about it, more relaxed, it's like, okay, let's say like 100 ppm lower concentration, 10% better improvement. And then I think I really like that model where it's like, if 90% of your annual expenditure is on your employees, their salary and benefits, wouldn't you want to make the investment in helping them be as productive as possible? So I think there's a case for it, but I think it's also hard when there are other competing interests.
10% is a massive number.
I would
If,
agree.
if, if I owned a factory and
Yeah.
somebody told me that simply by upgrading my ventilation system and keeping CO₂ levels high and oxygen levels where they need to be, removing VOCs, that I could get a 10% improvement in productivity, I'd be like, sign me up.
Yeah,
So 10% is a massive number when you're talking about, especially any kind of labor intensive manufacturing type operation or a call center, tech support center. Those are big numbers.
for sure. And I think it really is surprising because those numbers, like I said, are occurring at such a low range of CO₂. So when we're comparing already like a low upper value to those even lower concentrations of CO₂, it really shows the benefit of that kind of increasingly lower concentration of indoor air pollutants.
Yeah, for sure. Yeah, those are numbers that have got to be in people's faces for sure. Let's talk about indoor environmental quality in a little broader sense. You know, I'm a daylighting guy, so
Mhm.
I got to bring some light into this at some point, and this is the point. This is the moment. You know, we talk about daylight views, air quality, acoustics, thermal comfort. Is there another measure of IEQ that I'm missing? With that list I just gave.
I mean, I think that's pretty comprehensive for IEQ. I think there's like other areas of healthy buildings in general, like movement, or I was part of a indoor microbial community campaign many years ago, but I think you hit the main ones.
Is there a relationship between natural light and air quality, generally speaking, or has anybody ever looked at that? I always think about the UV component from the
Yeah.
natural light that, has got to have some sort of disinfecting effect. Are you aware of any sort of research in that area, or have you done any sort of research in that area?
Yeah, it's very interesting. I have not done any research myself. I've been more on the air side, less on the light side. I'm not familiar with any work that does demonstrate any association or correlation between the two. I'm sure someone else could correct me if there is a paper on that. I think the indoor air field too, especially with the pandemic, has been very focused more on UV as a mitigation strategy against
Right.
infection risk, and less
Yeah.
so on sunlight. Yeah.
Yeah, and that's exactly what I was thinking. You know, as we bring in natural light, we bring in UV as a component of it. And I was wondering if it does have some sort of disinfecting factor, if
I,
that's part of the reason that, people do so well with natural light.
Yeah, I think it'll be interesting. Like, I know there's been a lot of great chemistry work that's going on. And so there might be something interesting coming out of that since, I mean, like, sunlight, it's great for our circadian rhythms and whatnot and for our health. But when you have UV in spaces, a lot of chemical reactions can also happen. So, again, more on the UV disinfection side of things, we've seen some interesting kind of like chemical reaction concerns, but who knows? I don't know what else is coming out in that space, but we'll see, I guess.
Okay, okay. Let's talk about wildfires. It's a hot topic these days, no pun intended.
Yeah.
Seriously, there was no pun intended. A lot of issues with wildfires over the last couple of years all over North America. What recommendations would you have for managing indoor air
Yeah.
quality? And they're large particles from fires with all that particulate after a large fire. Is there anything we can be doing better?
Yeah, so assuming this is not a situation where people need to evacuate or there's like, you know, really intense
Right.
decontamination going on, it's kind of maybe like a shift in thinking because in indoor air quality, we usually have this like hierarchy of controls where first you want to start with source control, then ventilation, and then filtration. So with source control in this case, you'd want to start by trying to prevent bringing in anything from the polluted outdoors. So, taking your shoes off, possibly changing your clothes if you can, trying to be careful about not bringing in any contaminated items and tracking them through your indoor space. In this case, source control also kind of ties into ventilation since usually people often say like, oh, like ventilate with fresh air, but outside air isn't necessarily like fresh or clean all the time. And so in this case, it's actually not a good idea to bring in outdoor polluted air. So if you have a ventilation system in your home or like a furnace, some people might say, get to know the system and see if there is an outdoor air intake, and you'd not want to be using that outdoor intake. You'd ideally run it on recirculation mode and have a high performance filter in place. And if you don't have that, those portable air cleaners or like air purifiers that are just using filters like HEPA filters are really effective, or even the Corsi Rosenthal box really took off during COVID. I'm sure you're familiar with that.
I'm
No.
not. No.
Oh, okay.
Have to tell me about
It's very cool.
it.
So people, especially during these emergency events, it's like, oh, go get an air cleaner, an air purifier. And then unfortunately, because everybody's trying to do that, there's often a supply issue. So you can't just buy one at Home Depot or they're too expensive. But these two researchers, Corsi and Rosenthal, teamed up and demonstrated that you can buy just like furnace filters, and you can start just by taping one to a box fan, those like square fans.
Yeah.
So tape it to the box fan, turn it on, and when you pull air through that high performance filter, you're actually like people who have tested these have shown that they're better than a lot of comparable or better than a lot of off the shelf air purifiers. And then without getting too much into the weeds, like the performance is affected by the pressure drop across the filter. So if you increase the area, you're reducing the pressures. And so they basically made a box out of filters. Like, I think I'm taking all these flat filters, and then I make a cube out of them. And then on one side, I attach the fan. And when you draw air through all of those different sides of filtration, you get a higher CADR, that's clean air delivery rate. Yeah.
That's brilliant.
It's
That's
super cool.
absolutely brilliant. Yeah, I'm glad you brought that up. I hadn't heard that before. All right, I want to talk about some of your more recent research. You've probably talked about it a little bit, but you're doing some work which, is very near and dear to the core of this show. As I'd mentioned earlier, you're balancing health and energy through these lower carbon ventilation strategies. And you've also tied some of that work to extreme weather events. Can you tell me a little bit more so I don't massacre the interpretation of it any further?
Yeah, not at all. Well, it's still very early days. I'm very new to Switzerland and the team, so we're still getting things going and planned out.
Okay.
But yeah, we're very interested in looking at ventilative cooling potential. So how much can we cool spaces just with, natural ventilation like window opening and whatnot. And we're curious to see how that performs during like typical conditions, but also in extreme weather events. And I think a key to this is better understanding the role of moisture in this. So a lot of work that we've seen with heat waves typically focuses on temperature or like dry bulb temperature, just the temperature, not accounting for moisture. And then when we also see a lot of ventilative cooling studies and work, it again typically focuses on just temperature. This team here that I've joined, they also did a study in the past that looked at temperature and air pollutants. So based on the outdoor pollution, how much does that restrict the amount of ventilative cooling potential we have? And then we also want to take it one step further and understand this moisture piece, because I think it's quite understudied due to numerous reasons. There's a lot of, I think, confusion about how to quantify moisture in a meaningful way with respect to health, but it's also key to energy. Like moisture, it's surprising like how often you'll go into a building that feels too cold and you think they're like blasting the AC, but really that's to get excess moisture out of the air. So I think moisture is like this, sounds boring, I know, but I think it's this really key parameter to better quantify and understand with respect to both health and energy.
I have to ask an incredibly naive question.
No.
Filtration in a passive scenario. Do you have enough pressure drop to achieve any sort of, valuable filtration when you're doing a passive cooling scenario?
I don't think I understand. Do you mean like, so sorry, with the passive cooling work?
Can you move the air through a filter when it's just a passive scenario?
Oh, well, I think so. For the situations we're looking at, it's really just like window opening. So there wouldn't be a filter there.
There'd be no scenario where you'd put it through a filter there. Okay.
You could have then the portable air cleaner, but I think we're more looking to not bring in that air if it's polluted outside.
Gotcha. Okay.
But maybe food for thought.
Gotcha.
Yeah.
Okay. I have to move on to the point, the magic moment in the show where I ask the same question that I ask to every guest, and I ask people to respond from whatever perspective that they see fit. So, Sandra, what makes a great building?
Okay. Well, I think you're expecting me, and I do want to say, I think it should be sustainable and it should be healthy for the occupants. I mean, like, we don't build buildings to pollute the planet, right? Like, we build them for people. So I think they really have to serve the people and promote their health while also trying to be sustainable. But I think, I don't know, whenever I try to do something good, I try to do it in a way that's really enjoyable. And when I was in undergrad, I went to this talk by Steve Burrows. He's like an architect or engineer, and you may see him on the Discovery Channel too. And they were talking about building resilience, like resilience to climate change was a new topic at the time. And I remember him saying, this struck me because it seemed like unusual for an engineer to say this, but he said, in order for people to actually maintain their buildings and for them to truly be like durable and resilient, you have to make them beautiful because people really care about things that are beautiful. But even though I'm coming at this from like a very scientific engineering perspective, like air quality, energy, carbon, I really think you can achieve that in many ways, but I think it just really has to be a space that people love to be in and care about. Otherwise, I don't think you've achieved your purpose.
I've heard many times people say never sacrifice beauty. And that's one of probably many reasons, but a very good reason not to sacrifice beauty. I love that. Great answer. Sandra, before we go, is there anything that you'd like to share? Any exciting news about your current research? I know you've just made the move, but anything that you'd like to talk about that we haven't covered?
Oh, thanks for the opportunity to share. I guess I'll say that one of our papers that I mentioned, the one about COVID and increased ventilation in the classrooms, that one should be coming out any day now, maybe next week. So keep an
Okay.
eye out for that and any other work we're doing here at the team. But otherwise, I would just say I'm still figuring out the best ways to kind of merge public health and engineering for healthier and more sustainable built environments. So I'm always open to chatting and idea sharing. So feel free to reach out anytime, anyone.
Wonderful.
Yeah.
Sandra, thank you so much. This has been a pleasure.
Thank you for having me. This was so fun.
All right. You take care.
You too.
We hope you enjoyed this episode of Better Buildings for Humans. For more information on the world's best light diffusing and highly insulating glass glazing, please visit advancedglazings.com.